I think I think I'm going to stop there and let Laura start as our first presenter.
Okay, let me share my screen. Can everyone see that, or?
I just see a black slide that says you are sharing your screen. Does anyone else see the presentation?
Oh, let me see.
No.
Okay, how about now?
Oh, there we go. Yep.
Okay, great. Is it still visible? Just want to make sure. Hello?
You're good, Laura.
Okay, cool. So hi, everyone. My name is Laura. Thank you for taking the time to attend this presentation. I'm really excited to share my summer internship experience with you all. And the title of this presentation is Using Human-Centered Insights to Drive Demand and Use of the BCS Plus Toolkit. So this past summer, I was a design intern at Gobee Group, and they're a social innovation design consultancy headquartered in Oakland, California, but they have staff in other states and countries as well. And Gobee uses human-centered design approaches to solve complex social problems. So they partner with different organizations, both in the private and public sector, as well as domestically and internationally, in order to help develop products, services, and different systems for health impact. So I kind of wanted to start this presentation by defining human-centered design and providing a brief overview. I think it'll be useful in terms of framing the work that was carried out in this project and the different approaches used. So human-centered design is a collaborative approach to problem solving that provides creative methods to deeply understand human behavior and to develop new ideas and solutions directly for and with the user. And there are three phases. So this is how Gobee kind of looks at it. Understanding context in users, translating insights to solutions, and experimenting solutions for implementation. And these three phases don't necessarily always happen in order. They're iterative, so you can complete one phase and then go back to it later on. So it's a continuous process. So in terms of project overview, so Gobee was working with the Population Council this summer as a part of the ADVICE project, which stands for Advancing Integrated Family Planning and HIV Counseling with Evidence. And this project was supported by the Bill and Melinda Gates Foundation, and it aims to develop strategies and tools to improve family counseling and integrate HIV into that family planning counseling. So Population Council, they developed the BCS Plus toolkit. And it's this toolkit that has information for healthcare providers that they can use to offer family planning counseling services to individuals who are at a high risk of HIV and STIs. And currently the toolkit is online and it's available and accessible for anyone who wishes to look at it and view it and use it. So they were looking to redesign the toolkit and also design an effective distribution model for the toolkit so that it can be used widely and effectively. So they partnered with Gobee to conceptualize a distribution strategy and use human-centered design in creating that distribution strategy. So a little bit more about the BCS Plus toolkit. It provides materials to help healthcare workers deliver high quality family planning services to clients. And it was developed in 2015 by the Population Council, and that is the current version. So there are actually two previous versions that existed before this one. And this version incorporated messaging on HIV and STI risk into the counseling toolkit. So the current toolkit has an algorithm that helps family planning counselors counsel clients on the different contraceptive methods. It includes counseling cards, it includes method brochures for the clients once they leave the counseling session, and it also includes a trainer's guide and a user's guide. So these were some of the key questions that we had when we were going into the project. So what does it mean for the toolkit to be used? What are the goals? What are some barriers of utilization that we can remove? What is the cost of distribution and who bears that cost? Who are the different stakeholders? And also what are the different models of localization and adaptation? And we use various methods in order to answer these questions. So these are the main methods we used. We began with a landscape analysis, which included a literature review where we looked at various projects and studies that mentioned using the current version of the BCS Plus toolkit. We also carried out a heuristic analysis. And finally, we also interviewed users and non-users about the toolkit. So in terms of the literature review, we were really trying to understand what are the different use cases for the toolkit and also identify potential new use cases that Population Council may have not known about prior. So we assessed published literature, including peer-reviewed articles, conference abstracts, and reports that mentioned using the BCS Plus toolkit. And we discovered about 12 different studies that mentioned the use of the toolkit, and they were all from various countries, and there were cases in which the toolkit was used to develop a digital mobile job aid or a phone-based chatbot. And so it was really interesting to see how the toolkit was being adapted to different contexts and in different projects, such as peer mentoring projects, or provided to drug shop owners to utilize. So that was very interesting to learn about the different users and how it was being adapted. And then we also did a heuristic analysis where we developed about 20 heuristics, some related to the format of the toolkits and the job aids and the layout and design of the job aids. And we looked at 12 different job aids from the medical field as well as other industries, and compared the criteria to, we compared them to the BCS Plus toolkit. So we developed criteria to compare the two. And it was interesting to see how, you know, certain job aids, for instance, from the construction industry looked very different. And yeah, overall, just kind of seeing what was present in some job aids that wasn't in the BCS Plus toolkit or vice versa. And then finally, we also conducted interviews. So we had a interview guide and we conducted semi-structured interviews for the toolkit with individuals from different organizations that use the BCS Plus toolkit. So we had 4 interviews with users of the toolkit. There were about 8 users from different countries, and they included Indonesia, Kenya, Lebanon, and the Philippines. And then we also had 2 interviews with non-users. And these interviews were just really to understand how they were using the toolkit, why were they using the toolkit, any challenges that they may have faced. And each interview was approximately 45 minutes, and they were carried out virtually via Zoom. And I think this was probably one of my favorite parts of the process because it really highlighted the importance of hearing the perspective of the users. There were a lot of things that I didn't think of that were brought up. And so I just found it very valuable talking to them and understanding what potential options would work and what would not be possible. And then these were our key findings from the research that we carried out. So in terms of affordability, we found that the cost to print and maintain a stock of the toolkit can be very high. And in some countries, they are only able to provide the toolkit when they have support and funding from donors. So that impacts how sustainable the use of the toolkit is. And then we also found that many users were localizing the toolkit to fit their contexts. And in this process, it can be very time consuming and expensive. So kind of facilitating that process and making the toolkit easier to customize to different settings and contexts would definitely help alleviate this barrier. And some of the recommendations we had for the distribution strategy included developing a multimodal approach, so developing different formats of the toolkit that would support its adaptation to different contexts. This includes both physical and digital use. We also recommended building and leveraging partnerships with organizations and including them in the redesign process so that they can champion the toolkit in the countries that they work in. And then we also recommended that they develop a system where individuals are required to complete a simple licensing agreement and then also input the work that they're going to use the toolkit for, so that it's good for branding of the toolkit, but also Population Council has a better idea of what the toolkit is being used for and the different use cases in the future. In terms of professional development and skills that I gained from this process, I learned a lot about collaboration and communication, just working with different organizations, but also across the team, and seeing how, to delegate tasks and communicate where one another is, and also just ensuring that you're aligned on what the purpose is and what you want to get out of the research and the report. So I think that was a big takeaway. And then also just being in COVID and having to communicate virtually, I think it improved my communication skills as well. And then also I was able to see the beginning of the project. So I learned a lot about project management and development and what that process looks like, working on a timeline, developing tasks, and executing on concepts. So I think that was also very valuable. And then I learned a lot about the design process and different methods that can be used and how to communicate insights. So the methods such as like improving interview skills and also developing personas and journey maps and how those are useful in communicating the needs of the users and the participants. And then this wasn't directly related to the BCS Plus project, but we had a design equity book club throughout the summer where we would do different readings related to design equity and then talk about them after. And I really appreciated that there was a space to discuss design and equity and what that looks like. So that was definitely a highlight and something that I will definitely continue to learn and incorporate more into what I do in the future. And yeah, so thank you to the Wallace Center and thank you so much to the Gobee team for everything. And that's it.
Great job, Laura. We're all clapping. And ahead of time. So that you get bonus points for that.
Yeah.
So we'd like to offer up time for one or two questions from the audience, from anyone who's here listening for Laura about her project or experience. You're welcome to unmute yourself and introduce yourself and ask a question. Golindola, was that you raising your hand?
Yeah, I didn't see anybody else's hand, so. Hi, congratulations, Laura. I wanted to ask you, with this experience, I'm sure you went in with some expectations, and can you tell us what was unexpected to you and why, and what did you learn from this experience?
Mm-hmm. Yeah, so I think in terms of expectations, one of the biggest things that was unexpected was probably just learning. Like, I had an idea of what human-centered design was, and I'd taken classes that had talked about it previously, but seeing how it's applied and how much thinking actually has to go into things like interviewing, because you know, we had an interview guide, but it's also like a skill. So you need to practice. And so there were a lot of things methods that I knew about, but in practice looked very different and took a lot more time to grasp. So that was probably one of my biggest takeaways.
Thank you.
Can I ask a question? Can you tell us, I'm really curious about your design book club, and I want to hear a little bit more about that, and maybe what based on your book club, what would you recommend for the rest of us to look into reading?
Oh, good question. So yeah, there are a lot. We read, let me see if I can pull it up because I don't quite remember the exact name. I might just send it in the chat, but we read various articles and books related to design equity. And I think it was not just reading those, but also having the space to talk about it, because I think in terms of interpreting that information, like I didn't grasp it initially, and then talking about it with others, I was like, oh, okay, this makes sense. And people were able to share their experiences with the different methods and the different issues discussed. So I think in terms of like building knowledge, it was a very good forum to do so, because you really had to think critically about the content that you were consuming. So I think Olivia just shared one of them. Yeah, but it was honestly just having that space to talk about it and also share experiences and seeing how what we do in public health is really connected to design equity. And yeah, so it was overall just a great experience. And I would highly recommend book clubs because that was one of the first ones I was in. So yeah.
Or it looks like some folks have been putting some of the names in the chat box if anyone's interested in checking that out. Is there one more question? We have about 3 minutes. Gwen.
Hi, folks. Sorry I was a little bit late. Hi, Laura. Congratulations. I'm just curious. So you're a 4+1 student. I'm curious what's next for you, and are you going to take your design thinking skills into your next work, or what are you thinking?
Yeah. So I'm actually currently working part-time with Gobee, finishing up this project, and definitely looking at opportunities related to design thinking in the future. But we're still kind of in the process of finishing up the BCS Plus report. So that's what I'm currently doing.
Great. Thank you so much, Laura. I wish we were all in a room so you could hear the clapping roar, but that was great. And we're going to pass it off to your colleague from Gobee Group, Sarah, and you are a co-host there, so you should be able to share your screen.
Thank you. Hold on, let me make sure this is good. Can we all see that? Okay, great. Yeah, so I also was working at Gobee this past summer. So my presentation is human-centered design in domestic violence and HIV prevention. So as Laura already did a great job of introducing, Gobee is a social innovation design consultancy, and a very small one at that. I don't know if y'all know that, but our own Jasper is one of the founders, and including us 3 interns, there were 9 of us total this summer. So that was a really nice part of the experience, working on a very small team. And even with the pandemic, I felt like we really got to know each other very well. So that was a really great experience. And Laura already did a great job of introducing human-centered design, so I'll move on. So Gobee participates in a bunch of different problems that are running in parallel, and I was able to work sort of on actually two main ones. The Got Your Back project being my primary one, and if I have time, I might go over the other one that I spent a fair bit of time on. So this project was actually handed to me rather late in the process. So Gobee had run something called Reimagine Lab, which was basically an incubator for people who are interested in learning design, and everything was specifically aimed at ending and preventing domestic violence. So there were a number of teams that were developed through that process, one of them being the Got Your Back team. And over the 2 years that they had been working on it, they had developed, they had done some hackathons and run a bunch of different things, gotten a lot of great ideas together, but they were kind of at a stopping point, and the foundation, it was funded by the Blue Shield of California Foundation, was unsure how to move forward and wasn't confident that the idea was clear enough and to move forward in funding it further. So I was called in basically to re-examine and synthesize everything that had been done to date, as well as to look into the technological feasibility, as well as just the general landscape of some different options that this project could go in. And that included a number of different things. I ended up doing some secondary research on technology use, youth technology use, dating abuse, sexual behavior, as well as user experience design, analyzing the feasibility of different approaches, as well as clarifying what we meant by healthy communication. Sorry, I meant to mention, so the purpose of this particular project was to target 11 to 14-year-olds via some sort of technological intervention, perhaps an application, perhaps not, that would help youth foster and learn better, healthier communication habits. And I also did a bit of persona development and developing multiple possible product concepts. So the next few slides are some examples of some of that work I did, but they have a lot of stuff on them. You don't need to read the whole slide. So some of the secondary research I did was looking into the landscape of media use by tweens and teens, both before the pandemic and during. And I was able to find out a bunch of information about that, about like just in the past few years, how as of 2019, how much smartphone ownership has increased, as well as screen time, and like what avenues that screen time is being spent on. Definitely a lot of video watching and social media, and how those are playing out among different demographics. And I also learned quite a bit about user experience design for children and teens and how that does and doesn't differ from adults. As an example of something that I found really interesting, I found that that while the sort of like colloquial understanding is that, oh, these kids know how to use these how to use technology really well because they've grown up with it. While that's true to an extent, there's actually quite a bit of evidence showing that teens and tweens are overconfident in their ability to use and to understand the information that they're learning from online environments. So there is some adeptness, but less than we might think. And also that there is quite a bit to be said for individualizing your user experience to different age groups. And so the original conception was that of a text monitoring application. And so I looked into the different aspects of how that might work out technologically and how feasible that would be, and found quite a bit of difficulty in that realm, actually. I found that there were a number of possible ways that could work out, since there are different keyboard key logging apps, but that it's still rather in its early stages in the mobile world. And that that there would be quite a bit in terms of technical difficulties to overcome with that. And then so I looked more into the side of mobile gaming, since the general research of media use among teens and tweens was showing quite a bit of gaming, particularly among mobile gaming. And there are a number of different platforms for using existing platforms to create your own content. So that was one of the main directions that I was exploring in terms of where this project could go. And made a couple of mini personas of different users and their interests and needs. And then sort of the final thing that I did with this project was build out the different possible directions that this project could go to present to the foundation and give them an idea of the relative cost, feasibility, and impact of these different options, so that they could have a better understanding of what options really exist and what might be worth their time and investment. And they ended up going with Create Public Good, so which is going to be basically a report on what we found. So one of the smaller output options that we were considering, but I think we learned quite a bit from this process in terms of future projects that could be built on this. So that was the main thing that I was working on. And then I was also ended up helping out with another project that's been going on that's was in its much earlier stages at Gobee, which was the Central Asia region project with EPIC. And so this project is specifically looking at the key populations of people who inject drugs and men who have sex with men in Kyrgyzstan and Tajikistan in Central Asia. And so I came into this project rather early, like I said, and so the overall project was to use a human-centered design approach to inform PrEP as well as community ART access by assessing the current community knowledge of PrEP and clients' preferences for ART services. So currently, ART is distributed at Republican aid centers in these countries and is not distributed by the community organizations that the individuals interact with more directly. And so we were looking at the possibility of community distribution of ART as well as introducing PrEP in a community distribution way. And so I assisted with a number of tasks in this process. I assisted with part of the landscape analysis, looking at a small number of cases of using human-centered design in PrEP distribution projects. And that included things like demand generation, uptake and retention of oral PrEP, and linkage to care. This I found very interesting because PrEP is relatively new still, you know, it's been around for a couple of years, so there are already a few like really interesting projects to look into how they've been going, but it's still new enough that there's a lot to learn. And it was really, my favorite part of this project was just looking at the state of PrEP in the world right now and what are people's thoughts coming from the different projects that have already gone through. So I was looking at that, as well as I helped out with us interviewing some local community service organizations in these countries. So we got to deal with the fun like translating over Zoom and that whole process, which was not as bad as you might expect, but it was definitely interesting. So I helped out with that, and as well as helping out putting together a WhatsApp group that we put together for peer navigators specifically from these organizations to get them to know each other and possibly share the different strategies, as well as just to learn more about their experience and help that potentially inform our project moving forward. And I was able to help a little bit in the planning stages of the co-design workshop that was the endpoint of our participation in this project, which was getting key experts, decision makers, and members of these key populations together in these workshops to plan out how to consider possible community distribution of PrEP and ART. And so, for example, this was a journey map that we put together that was put together primarily from the information we got from the interviews with the community service organizations, as well as our own research independent of that. And so we broke the different the challenges that we were hearing that were frequently mentioned in the interviews down into a few different subject areas, because we wanted to structure the workshop to focus really on the challenges that the CSOs were telling us that they were experiencing, as well as the actual key populations were telling us that they were experiencing, instead of just jumping in right away necessarily with something like demand generation. While that was definitely part of the goal, we wanted to structure it really focusing on these challenges and how to address those directly if possible. So there we go. And so we were able to group them together. And here's a couple examples of some of those key challenges. So we found that there were some issues reaching minority ethnic groups. That was particularly challenging because they are stigmatized groups, and so they're hard to reach in general. And so there were some specific issues with those groups, even within PWID and MSM groups. We also, another one was that there was a lot of concern about criminalization. So even though drug use is not necessarily illegal in either country, a lot of related things are, such as possession. And so there is a lot of interaction with police among PWID, as well as the peer navigators themselves. And we even heard from one organization that peer navigators were sometimes concerned about being harassed by police or interactions with police. There's also some concern that we found, this wasn't as much, didn't come up as much in the interviews, but we found out separately that there is potentially some concern globally about the over-medicalization of HIV and how PrEP could potentially increase that by seeing PrEP as something just to fix with medication, instead of continuing to invest in existing things such as harm reduction and other strategies. And so we were able to ask someone who worked at implementing PrEP in a different country about their experience with that. So we heard a majority of thoughts on that, but that was definitely an issue that I hadn't thought of before that I found interesting. And then adherence monitoring, I also found very interesting when I was learning more about PrEP in general. Since PrEP is different from ART, how to actually properly monitor adherence is a bit of an open question at the moment, because PrEP, ART, you can pretty much expect that people should be taking it every day for the rest of their lives, whereas with PrEP, it's not so clear that that's necessary in every one case. So those were a couple of challenges that I specifically was really interested in and was taking a look at. In terms of professional development and skills belt, I can totally agree with Laura and about, so I learned a lot about design and human-centered design just in general, and how to look at things from a design perspective. I learned a lot of specific design methods, such as landscape analysis and persona development, and a bunch of other processes like that, and developing insights from informational interviews. I think that was kind of the first time I'd really been a part of the interview process, and that was really exciting. And I would definitely echo that our Design Equity Book Club was a highlight for me. We learned a lot about not just public health design, but just broadly, with me having a bit more of a computer science background. A lot of it was definitely very relevant to my own and my friends' experiences there. So that was a huge highlight for me. And I just want to say thank you to everyone, to the Wallace Center, and thank you so much to everyone at Gobee. I had a lovely time, and this was a great opportunity.
Great job, Sarah. Thank you for sharing. Again, I think we have time for 1 or 2 questions. Anyone want to ask a question? You can either raise your hand or just unmute yourself. Or type in the chat box.
Should I go?
Indola's always got
Sure.
questions.
I always have a lot of questions. I don't know. So I like the presentation. So thank you, Sarah. Really great detailed presentation. So my question to you is, how do you think after being, through those two projects, how do you think, at least in the first one where, it was almost complete, what difference did human-centered design made?
Yeah, so I'd also kind of like to point out, it was really interesting being involved in projects at different stages. Because that one I was pulled in sort of at the end. And so actually a lot of the human-centered design aspects of that project had been done before I got there. There was still more to do, like Laura mentioned, it's a very iterative process, but it was just at a very different stage. Whereas with the EPIC project, we were really at the very beginning, and so we were continually reminding, trying to figure out how to make sure that we were really talking to the right people and asking the right questions, and integrating that into all of our ideas moving forward. I don't think that quite answers your question. Can you repeat the question though?
So the project, for example, was on the prep project. That's just an example.
Yeah.
So if human-centered design didn't exist, that project would take some shape.
Sure.
So my question to you is, having been part of the project, what do you think make a difference to this project by using human-centered design? It's not a tricky question.
Sure.
Is one that you're probably going to face in many places when you suggest human-centered design for a public health program, because many people, I'm old and my age, we didn't have that. So we are learning now how to integrate that into our projects. You guys are the experts that teaches us the value of human-centered design, right?
Yeah, I think the biggest thing for me was really making sure that we were actually including key populations in the decision-making process. And that was also a thing that we were talking about a lot in the Design Equity Book Club, is that there's designing for a group and then designing with a group. And so it was honestly a little bit challenging, right? Because this workshop that we were putting together was primarily with people that were part of different funding groups. And while we were definitely, key populations and people working at CSOs were always going to be a part of that, the priorities on all levels are, just kind of historically not necessarily coming from the populations we're trying to serve. And so us structuring things around the challenges that we knew that KPs had been expressing was, I think for me, one of the main ways that made a big difference is making sure that we weren't just talking about how do we, reach this population and get them to want PrEP, but how can we actually address the issues that they're facing that is keeping them from accessing the resources that already exist and would keep them from accessing the resources that we want to add to that. Does that answer your question?
Yes, thank you, Sarah.
Hi, Sarah.
Thanks, Sarah.
For this side, so I have a question.
Mm-hmm.
So you emphasized on feasibility and impact in one of the diagrams, and on that the findings are not unanimous. You said that designing for the people and designing with the people, feasibility. Impact. So if you have to do it all over again, what will you suggest?
For the GYP project, for the original project?
Yes.
I mean, so one of the challenges that I found just at the stage that I was coming in is that we didn't really have the time or ability to reach out to 11 to 14-year-olds at that stage. There was a lot of great user interviews that had already happened, and I spent a fair bit of time combing through those and putting together common themes that I saw throughout that. But definitely just a difficulty of the circumstances of where I was at, especially with COVID, was that I wasn't able to, for myself, as I was trying to think of different ideas of how to move this forward, I wasn't really able to reach out and you know, I didn't have a focus group, for example, of 11 to 14-year-olds to check my ideas against. I was mostly relying on what had already been asked of them and the answers they'd already given, as well as what I was able to find just in secondary research. So, I mean, ideally that would have been changed. I don't know how though, because we were definitely asking those questions at the time. So.
Okay, thank you.
Thanks, Sarah. We are going to move forward just to be able to stay on track, but great presentation. Thank you so much for sharing. And thanks to Gobee for hosting 2 students. We really appreciate it. Mayella, correct me if I pronounced that wrong. You are a co-host, so you should be able to share your screen and get started.
Okay, great. So let me just get that all set up. Hopefully you all can see. Can everyone, oh wait, which screen are you guys seeing? Sorry, I have 2 screens also.
We can see your presentation. Yep.
Okay, is it full screen now?
Yes.
Great, that's great. Okay, so here we go. My name is Mayella Gillen, and I'm a second-year MPH Environmental Health Sciences student. And this summer, I worked with Health Research for Action on a community engagement and education piece around arsenic contamination in Kings County, California. First, I'd like to invite everyone to reflect on the lands which we reside, to acknowledge our ancestral homelands and, oh wait, hold on, sorry. Our ancestral homelands and traditional territories of Indigenous peoples who have been here since time immemorial, and to build our solidarity and kinship with Native and Indigenous peoples. I specifically acknowledge the Tachiyokut people who once lived as a nomadic people across what is now Kings County, where this research project is based. So, let's move. So Health Research for Action at the University of California, Berkeley has worked in many different communities to use research to promote overall awareness about exposures that affect the health of different communities. In Kings County, HRA is focused on providing education and engagement activities to children and has created multiple STEM activity or focused lesson plans for schools in the area. The STEM activities teach children about these specific topics: where water comes from, water cycles, the health impacts of water that isn't clean, how we clean our water so that it is safe, and how to keep water clean. The work at HRA is led by the community, and the major goal in this project was to increase awareness of water pollution in the community and to foster overall community readiness for the implementation of the ECAR water treatment system at our partnering school, Central Elementary. First, I'd like to talk about what the problem is with arsenic. So arsenic is a naturally occurring contaminant which is present in the Earth's crust and can accumulate in groundwater. So why is it a problem? Although it's naturally occurring, chronic exposures to arsenic can lead to gangrene, amputations, neuropathy, skin lesions, painful ulcers, lower IQ levels in exposed children, and internal cancers such as liver, lung, kidney, and bladder cancer. The current maximum contaminant level, or MCL, for arsenic in our drinking water is 10 micrograms per liter, but at this level, there is still a risk of cancer risk of 7 people per every 1,000 exposed. At this level, arsenic has the greatest cancer risk when it is compared to any other waterborne regulated contaminant. So here is a graph showing us the lifetime cancer risk of other regulated carcinogens. And here is another one that includes the lifetime cancer risk for arsenic. And this is per 100,000 people. As we can see, at the allowable level for arsenic, we have detrimental effects. So let's look at Kings County. This is a map that I created in order to better visualize the arsenic contamination in all of Kings County. As we see here, there are blue and purple dots on the map. each dot represents a municipal groundwater well in Kings County. And so each light blue dot means that the arsenic level found in that well is below the MCL of 10 micrograms per liter, and every purple is above that MCL. So let's zoom into the area we focused on for this project, which is Central Elementary. Here we see the elementary school, and it sits right between the city limits of Lemoore, California, and the Santa Rosa Rancheria, which is the Tachiyokut Reservation. The enrollment total here is 268, and it serves a diverse group of Hispanic, Native American, and white children through kindergarten and middle school. We can see the school sits on a purple dot, so let's look at the arsenic levels here. Currently, the arsenic levels are 11 micrograms per liter, which is above the maximum contaminant level. Other wells
Did Mayala freeze for anyone else?
Yes.
Okay, just Mayala, if you can hear us, I think you're frozen, which one option you might want to try is, oh, it's okay. Technology, we've been doing it for a while. It's totally okay.
Sorry about that. Okay.
No worries.
Sorry, let me try to get back to the screen share. Okay. I felt like this might happen. Okay, so
That's totally okay. We've all had this happen in the past 6 months.
Okay.
So don't worry.
Let's get it big. Hopefully, was this the slide that I was on when I fell off? Okay.
Yeah.
Sorry about that. So, okay, going back into it. So now we're looking at the wells and the arsenic level in the well that serves this elementary school. Of their 3 tests that they did of that municipal well, it's at 11 micrograms per liter, which is above the MCL. And other wells in the area have been much higher, some over 90 micrograms per liter. So since the school is outside the city of Lemoore and off of the reservation, they aren't tied to treated municipal drinking water, which removes some of the arsenic. And since getting notice of this out of compliance contamination level at the school in 2016, they've shut off all of their potable water sources, and they provide bottled water to their students and staff. However, the funding for this bottled water has been running out. So moving on to talk about the Gadgill Lab. So this brings me to the eCar technology that was created right here at Berkeley by the Gadgill Lab. They created a filtration process that successfully removes arsenic contamination to levels well below even the maximum contaminant level. So this electrochemical arsenic remediation, or eCar, filtration process, arsenic is converted into a substance that can be more easily filtered out through settling tanks and filtration procedures, things that we usually do with other contaminants. So, and they've been doing this in India to remediate the drinking water concentrations below even 1 microgram per liter. So HRA and the Gadgill Lab has come together to offer an effective and efficient solution for the school involving the implementation of a new water treatment system, which has been successful thus far. And so then for the summer, one of the main goals for this project was to increase community environmental health literacy and overall awareness of water quality. So we did this by creating STEM education materials for the teachers at Central Elementary. These materials included sets of student worksheets and instructor PowerPoints and teacher guides. They were all individually created for both grades 3 to 5 and then 6 to 8. And so also due to COVID-19, we created these activities and materials with distance learning in mind. So to go over those really quickly, first we ended up creating 5. And the first one was in the water introduction modules A through C. And in this module, we introduced students to the states of matter, what a watershed was, and talked to them about the history of the water in Kings County and rivers to clean water. We created these modules using Google Slides and incorporated various media, videos, personality quizzes, songs, and interactive maps to engage students in the material. We go through these topics to introduce students to the language and to help them gain an understanding of both water in general and water in their community. So, and then next we made the acid egg module, which is where students would put raw eggs into liquids with varying acidity levels to kind of see what would happen. And it's an interactive experiment for distance learning. And the purpose of this activity was to teach students about the impact that substances can have on our bodies and to introduce them to scientific thinking in terms. In this experiment, eggshells act as, or they're acting similarly to our teeth and bones. And the higher the pH of the liquid, or the lower the pH of the liquid the egg sits in, the greater the effect it will have on the eggshell. And then lastly, the STEM filter module, which is where students would filter dirty water through these different medias. And the purpose of this activity was to show children the complexity of filtering water and getting them to think about what it means to have clean water. In both of these interactive STEM activity or experiments, teachers and students would be sent the materials, and the teachers would first show the students every step of the experiment, and they would make a hypothesis together. And then the students would be sent their own package with their own materials so that they could better interact with them and make their own individual observations and hypotheses to then share back with the class. So, and then hopefully this doesn't get too tricky, but as another part of the summer project, I created a story map using Esri software that could be used as a community tool that anyone in Kings County could use to learn more about arsenic levels in their groundwater and the health implications of those levels. So I'm going to, hopefully you guys will all see this. Please tell me if you are seeing a story map now. Okay, and I'm just going to very quickly go through it because I've already gone through everything that's in here before. So we talk about what watersheds are, what the groundwater is, and this shows people about the groundwater basin that they live in, and it's interactive so you can click on it. However, my internet's a little bit slow. And then I talk about the history of the Tulare Basin, what it looked like 170 years ago versus 20 years ago, a little bit about the Tachiyokut tribe and the health effects of arsenic and chronic exposures, and the importance of making sure that children are not exposed since they just have a smaller body volume, that the level is much higher. And then this is the community interactive map where you can put in your address or a specific place to see where the groundwater well nearest to you is and what the contamination levels have been of that well. And then just about the community partnership and the Gladgill Lab and the e-car removal process. So that's the whole community engagement piece, and hopefully now I am sharing the presentation. Oh goodness. Oh no. Okay. Okay. Anyways, so here's the summary slide. I don't know if it's full screen anymore, but that's okay. In summary, we know that arsenic in the Central Valley groundwater is commonly above the MCL, and this is the case for the well servicing Central Elementary. And it's a specific concern for those outside of incorporated territories who aren't connected to municipal water lines. Chemical exposures have a greater effect on children and disproportionately affect people in minority groups through these STEM education pieces. Not only are we increasing the community's environmental health literacy, but we're also attempting to close the gap of these disproportionate chemical exposures and any subsequent health effects through this knowledge sharing. The STEM activities we finished were done to engage students around environmental health science topics, but also to increase the readiness and acceptability of the ECAR treatment system at Central Union and in the general community. Through open and honest dialogue with the community, we've fostered trust, and there is already excitement and around both implementation of the ECAR system and the STEM education pieces for the students. And then hopefully this, okay, yeah. And then next steps. So I was able to stay on the project, which I'm very excited about. And our next steps are creating video introductions to help that kind of where students are not in the classroom and that kind of switch to online learning. We're going to be editing the current modules and creating 5 to 8 new ones, which are going to be really exciting. And then, creating more evaluation tools through quizzes, how effective these pieces were that we've already created, and then making sure that they're easy for the teachers to use through the teacher evaluations and feedback forms. And then my acknowledgements to the Wallace Center and HRA and the whole team and the Gladgill Lab, and just everyone, thank you very much for all of your support. Yeah.
Great job. That's such a good example of working with the community to prepare them for adapting to new technology that might be introduced. So we do have time for 1 or 2 questions from the audience. You're welcome to stop your share screen if you'd like, so you can see everyone's squares as anyone asks you a question, and folks can unmute yourself or write in the chat, whatever works best. Any questions?
Sounds good.
Hey, Mayela, this is just Paul. Congratulations and thanks for sharing that. This isn't my real question, but a request. Would you mind sharing the link to the story map in the chat for us?
Yeah, of course.
My real question, it's great to hear about all that excitement that the community had and that you're able to touch so many different parts of this project. I'm curious if over the summer in your current work with the team, if there's any resistance or pushback from anybody in the community.
So we haven't encountered a ton of pushback. Everyone seems to be very excited. The reservation and the people who live in the area really value water, and even the water that exists on the reservation is brought up to levels that are, the contamination levels are lower than our current standards. So they work very hard to make sure that they are addressing these standards that aren't always more conservative of human health. So I feel like a lot of people in the community and around are very receptive to helping. And since it's impacting such a sensitive population, their children at the school, they seem to be very excited to, bring that to light and, help everybody.
Great, thank you. We have time for 1 more question, and then we'll make sure to get everyone out of here on time and give Danny time to present as well.
I have a question.
Sure.
This is a really great project and really interesting presentation. Thanks, Mila. I'm interested in the ECAR technology, and I'm wondering how expensive it is and how sustainable it is. And yeah, I guess those 2 questions.
Yeah, of course. So the eCar technology has been extremely efficient, and they were able to implement it in India. And at the moment, I don't know how much it costs, but what they did is they built the system and, ran it for, I think it still runs in the community that it was tested in India. But what they did is they gave the water to the community at a discounted rate that the original water that was contaminated, if that makes sense. So it paid for itself in a sense. I think that that's what we were told through with Gladgill Lab, that they had implemented the system, and then the community would pay like 20 cents per gallon or something like that of water, and then it paid for itself in that sense. And then the system itself is quite small when it comes to water treatment systems, and it's very effective. I think that part of the problem with the current MCL is that we haven't had a good way of remediating the water down to a level below that. And this technology makes it more feasible to get the water even further below 10 micrograms per liter. So, yeah.
Great. Thank you so much. And the story map everyone's writing in the chat is very impressive. So thank you so much.
Thank you.
Fanny, I have made you a co-host, and you're welcome to share your screen and get started.
All right. At a vocal yes that you can see my screen.
Yes.
Yeah.
Yes.
Thank you. All right. Hi, folks. Thank you for hanging in there on a Friday afternoon. I am going to talk about U.S. abortion support worker perspectives on the Safe Abortion mobile application. This summer, I was a research intern at Hesperian Health Guides, which is a small nonprofit in Berkeley. It's just a few blocks away from Berkeley Way West. And it's an organization that's focused on health education and community empowerment. They're probably best known for the book Where There Is No Doctor, which they originally wrote in the 1970s. And since then, they have expanded print materials to include a wide variety of health topics. They also have free digital materials, including a health wiki and mobile apps. And materials are translated into more than 85 languages and are used globally. Oh, okay. All right. So the technology and innovation aspect of my internship project lies in its focus on a mobile application. The is intended to provide information to people on safe abortion. Hesperian's interest in producing an app specific to abortion is for several reasons. First, they were aware that since 2016, there was increasing use of their help wiki by people who were accessing it from mobile phones. They also knew that there was increasing use of their health wiki to access women's health and reproductive health information. And in particular, their safe abortion pages in a variety of languages were consistently among the most accessed pages on their health wiki. On top of that, they knew that increasing numbers of people were accessing women's and reproductive health information from mobile phones. So all of that pointed to a demand for reproductive health information and potentially safe abortion information by mobile phone users. Add to that the global abortion policy environment, which is continuing to become more restricted. That made Hesperian want to make access to its safe abortion information even easier. Also, it's been shown that even in low resource settings, many folks have access to mobile phones, and increasing amounts of folks have access to smartphones. And then when we look at reproductive health apps, although there are a lot of reproductive health apps out there, relatively few of them cover abortion at all. And those that do not cover it in any comprehensive way. And so real gap in the app space for apps that provide comprehensive abortion information. Goals of the Safe Abortion mobile application were to provide free, comprehensive, practical abortion information in a user-friendly format, accessible offline and without using a data plan once the user had downloaded the app to their phone, that was available in multiple languages and was discreet for the user. Going into this project, the Safe Abortion app had already been developed. It had already been tested with a variety of potential users in 13 countries in Africa and Latin America. An English version existed, but very minimal testing had been done with users in the US. And so Hesperian wanted to understand ways that the app could be used in the US context and what modifications, if any, to be used to make it more useful in that context. And it's really worth noting that historically, Hesperian has worked outside of the US and primarily in low resource settings. So their attention turned to the US for this project for a couple of reasons. First, abortion is legal in the United States at the federal level, but that federal legality sets a floor, it sets a minimum, and states are allowed to set restrictions above that. And 2019 was a particularly active year for state level abortion restrictions. So the map here shows in orange states that enact abortion restrictions in 2019. Layer on top of that the COVID-19 pandemic. Some states attempted to restrict abortion or outright ban it in the pandemic. And even in states where no such restrictions were attempted, impacts to the healthcare system just because of the pandemic really caused negative impacts to people's ability to access abortion. So those factors really turned Hesperian's attention to how this app could be utilized in the US more effectively. We chose US user population for our testing based on a couple of things. From previous testing that had been done, particularly of the app in Latin America, Hesperian knew that it was being used by people who accompany and support people seeking abortions. The picture you're seeing here is of the Socorristas in Red, which is a feminist collective in Argentina that helps people seeking abortion. So based on this information, and because there's also of lay people supporting folks seeking abortion in the US, we decided to focus on these individuals in our user testing in this project. And so the goals and objectives for the project, ultimately we wanted to understand the role of the Safe Abortion app in meeting informational needs of US abortion support workers. But the thing is that US abortion support work is really not well understood. It's really, there's not a about it in the medical or public health literature. So before we could really get at how the app served or didn't serve US abortion support workers, we had to first categorize the work of US abortion support workers and identify their informational needs and habit in doing their work so that we could then understand how this abortion app does and doesn't address their informational needs as they're doing their work. So I did semi-structured virtual interviews with US abortion support workers. This was preceded by an 11-item pre-interview survey that was administered online, and that included the consent process. Inclusion criteria were the participants had to identify as current US abortion support workers. They had to be at least 18 years old, be able to speak and read in English. They had to have access to devices that allowed them to participate in the video conference interview and to download and use the Safe Abortion mobile app. Recruitment was from late August, and I recruited through a couple of means. I first partnered with local support organizations that I had personal contacts to and used those to do what I call warm outreach. So they basically did intros for me with organizations that they I did cold outreach to organizations that I didn't have personal contacts at via publicly available contact information, generally publicly available email media. And through those efforts, I reached 40 different organizations. And then in the midst of the project, one of our participants shared the information to a national abortion support listserv, and that got us participants as well. Interviews were from late July through early September. These were 60 to 90-minute video conference interviews conducted with 1 to 2 participants each. For the cases where it was 2 participants, it was from the same organization. Transcribed verbatim, analyzed using inductive and deductive codes, and content analysis is ongoing. So this is a snapshot of our study participants. I interviewed 13 abortion support workers. All of them were under 50 years old. Most of them were between 18 and 29 years old. Their support work is done throughout the US, although most of them work in the Western region. We had representation from both hostile and supportive abortion policy environments, although most of them do their work in supportive policy environments. And in terms of modes of support and types of support, we had a pretty good representation in our study population. So I'm going to go over preliminary results, objective by objective. I'm going to be as quick as I possibly can. And keep in mind that this was a qualitative study. So what we're doing in a qualitative study is taking interviews and really looking for themes to emerge across those interviews. So for the first objective, where I was looking to characterize the work of US abortion support workers, the theme that really emerged, or the 2 themes that really emerged, limited awareness of abortion support work, and the idea that abortion support workers wear multiple hats and really approach their abortion support from multiple different perspectives. The one that I'm going to focus on for time is limited awareness of abortion support work. And so what I have are 2 quotes from participants. The first one is real short and to the point, which I appreciate. But I want to highlight the second one because I think it really gets to the heart of what these folks do. The person says, the information of just abortion funds exist and abortion support exists for callers and people who need that support, because there's no way of knowing how many people never reach out and call a provider, call Planned Parenthood, or research, or just Google, because some people find us through Google. But that takes some level of knowing or hoping that there would be support out there. For my second objective, I was trying to identify the informational needs and habits of US abortion support workers, and the 2 themes that really emerged was this real need to have information contextualized in terms of the state that the person was doing their support work in, and also the value of using internal documents and resources within an abortion support organization. So I'm going to touch on each one of those briefly. For state context, I'm going to highlight the end of the second quote. It's really hard for me to just pick one thing that a person says, so I apologize for the texty slide. But again, because there's so much state level restriction in the US, a lot of what was coming up for these folks was that their information really needed to be the lens of the reality of what was going on in their state. And so this person says, I feel like that's important to our clients because it's the kind of general information is helpful, but the questions they have come up around the realities of the laws here. They're asking for us to reflect things through their reality. Another really strong for their informational needs and habits was this idea that these organizations have these internal documents, these internal, they're not even databases, sometimes they're working in hard copy resources that they really, really depend on for their work. It's a binder, it's a folder. The first one is an amazing example of this, but we a printed out book we give folks that's like 30 or 40 pages long, and the person laughs and says, well, I guess it's 60 because it's 2-sided. We just printed a whole handbook. And to a person, every person I interviewed talks about their folder or their binder or their packet or their book that they have generally in hard copy that they absolutely on to do their work. And objective 3 was then to understand how the Safe Abortion app does and doesn't address these informational needs. And this really relates to the previous objective, and you'll see that the themes really connect. So again, we see state context coming out. And the second theme is something that I refer to as all in one place and with you at all times, based on the wording of what people said. So for state context, this relates to informational need really being state context based, like we saw in the previous objective. And what the second person says really gets to it. And again, this is looking at whether the app meets the And in general, what folks told us was that the app didn't meet their needs because of a lack of state context. So the person says, I think in the US specifically, where we have 50 different sets of laws, that's going to be one of the biggest information barriers. If that information is not in the app, they're still going to need to go elsewhere. And depending on what state you're in, it's really crucial to know there's a waiting period or whatever other limitation barriers there are. I feel like that would be almost more important than knowing exactly how a pill works. You know, if you can't get there in the first place. And then the second theme refers to kind of getting at the resources they use, especially those really crucial hard documents. So the first person relates to all in one place. They say, I like how it's all in one place. I'm looking for the value of what this is over visiting PlannedParenthood.org or something like that. And just how easy it is to use an app form is a big thing in of itself. And the second person says, the questions come up kind of in the moment. Unless you've got that folder with you at all times, isn't totally practical. It's super helpful to have it in some form of electronic resource. So really talking about ways that the app was meeting their informational needs. So in terms of skills built, this was very much an adventure in qualitative analysis. I want to give a shout out to Claire Snell-Rood's qualitative analysis class that I took in the spring. It set me up for a lot of success in this work. And so writing an interview guide and using it, practicing and then getting to use my virtual interview skills, coding a transcript, these were all things that I learned in course and used heavily in this internship. And I appreciated the fact that I then got to go beyond that and do content analysis, which is what I'm doing now. This is an actual picture of someone doing content analysis. And I want to give a shout out to Barbara Laraya, who is helping me navigate my way through content analysis and build that additional skill. The other thing that I really appreciated, and I don't know if this counts as a skill built, but the other thing I really appreciated internship was the opportunity to step out of an academic headspace. As someone who has spent pretty much their entire adult life functioning and working in academia, I appreciated kind of being forcibly removed from that and having the opportunity to work somewhere where everybody isn't wholly worried about what paper they're writing next and what they're actually thinking about. Not that that's not important, but yeah, it's real different perspective outside of academia. And I appreciated getting thrown into that. And I thought that was a really valuable skill built. I would like to thank everybody at Hesperian, in particular the folks listed here who are the members of the Safe Abortion app team, and in particular Lori Berenson, who is my preceptor, who is an absolute delight to work with. Thank you to the Wallace Center for sponsoring my internship, and in particular Kim Harley and Barbara Laraya for their support of my project. And I'd like to thank the following folks from SPH, Bridget, Linda, Jaspal, and Claire, who supported my project and talked through things with me at various points. Thanks very much.
Amazing, Danny. That was fascinating. I'm sure others agree. We do have time for one or two questions. If folks do have to jump off, of course, you're welcome to do that, but I'd love for anyone who has questions to please feel free to type in the chat box or unmute yourself and ask Danny.
I have a question, Danny. This is Cassie Marshall. Great presentation. One thing that I was thinking about as you were talking about is like the invisibility of the support work. And I guess my question for you is how can we do a better job of, I guess, getting the word out there that these services exist, and also educating on what they are and what they're not?
I mean, oh boy, how much time do you have? I mean, I have a couple of thoughts. I mean, so some of that was coming up in the context of talking about the app that we were working on, because they were like, y'all don't even talk about this, and you need to, because people don't know that this exists. So until resources actually say, hello, abortion funds exist and you can ask them for money. Practical support organizations exist and you can ask them for a ride, and you can have somebody help you with your paperwork at Planned Parenthood. Like, folks don't even know to ask for this stuff, and why would they? Because, and I think there's stigma, there's folks just not knowing. And I also think that there's another thing that I didn't even get to touch is this really big disconnect between who does the support work and who gets the abortions. Because depending on one of the real big limitations, and I'm sad that I didn't collect this in my survey data, I didn't ask what race they were. And there's an overwhelming whiteness to abortion support work in the US. And there is not an overwhelming whiteness to who's getting abortions in the US. Like, that's dual. And so there's this really big disconnect between where the support is coming from. And I feel like that also creates an informational disconnect. The support is not it relates to what we've been talking about in the previous talks. It has to come from within. And I feel like there are some communities that are doing that incredibly well. And a lot of spaces, the privilege around who gets to volunteer and who gets to self-designate as wanting to help really get in the way of that, if that makes sense.
Yeah, thank you. Great job.
Thanks, Cassie. I think we'll take one more question and then wrap up and let everyone get to their weekend. Anyone else have a question for Danny?
Hi, just
Hey, Danny. Hi. Thanks for the presentation.
How's it going?
It was really great.
Yeah.
I have a lot of questions for you, but I'm only allowed to ask one.
Oh my gosh, I'm so excited.
I'll send you the other ones afterwards. I'm curious about maybe different ways that the technology could be envisioned with the same idea of supporting these abortion support workers here in the US. It seems like porting this this technology that was designed for global audiences to the US, there's still this model of curated content and it being accessible. And I'm wondering what you think about technology that, don't worry about the cons, we all know the cons, but maybe the positive aspects of something that is like a closed user group, like a social network of abortion support providers, what value that could bring to either improving their work or addressing the point that you just brought up, which is being more inclusive and drawing in new and more diverse types of folks.
I think there's something to that. The other thing that I didn't get to talk about, so one of the strong themes is depending on support from other organizations. So as you talk to these organizations, you're like, well, where did you get your internal document from? They're like, oh, from the doula state over. And then you talk to that doula group, you're like, where did you get your stuff from? They're like, the doula group one state over. Nothing was more exciting than the interview where I got to the person, I'm like, where's your source? And she's like, I'm my source. I'm like, you're the person everyone talks to. I got back to person zero. She's like, it's all in my head. And I'm like, yes. But it's like this daisy chain of we have this internal document that's sourced from these three groups, but we only talk to these three groups. And so what I'm hearing when you ask that question is and some of the things I talk to with these folks is how do we network you together? Right? You all have this binder, but only you have that hard copy binder, and then everybody else has their binder, but nobody's binders interface. And yeah, yes, all of that to say on a Friday afternoon, agree, please subscribe. Yes, let's talk more.
Thanks, Danny.
Awesome. Thank you, Danny. Before everyone jumps off, I just want to give a heartfelt thank you to not only our students for presenting today and putting in so much work over the summer and sharing, but our organizations and preceptors who we couldn't have done this without you. So we just want to thank you all for your partnership and for supporting our students. And with that, we'll let you off to a great weekend. We hope to see some of you next Tuesday at our last set of these presentations. Bye, everyone.
Everyone, bye.